Many people live with chronic pain and are often left dealing with the side effects from pain medications. Now, is there a better way to deal with these kinds of conditions? Today's guest regularly sees patients who struggle with pain. Dr. Clayton Koganow, a naturopathic doctor in Lethbridge with Well Vitality Health Clinic. He also has done some training in conventional medicine with a Bachelor of Science in Exercise Science Kinesiology and doing 3 years of research on radiation and cancer at the University of Lethbridge. Dr. Koganow, welcome back to BCN.
Thank you for having me.
So let's talk a bit about your approach to finding solutions for health struggles that many of us face on a daily basis, including a bad cold in my node that I have right now.
Yeah, there's, well, it all depends on what someone comes in with in terms of chronic pain or pain in general, but there's various ways to treat it. And yeah, it's just something that is really, it's a case-by-case basis.
Right. Now, how common is chronic pain in today's society? Are you seeing more of it?
It's massive.
Is it seniors or is it also some of the younger generation too?
It varies. There are a lot of seniors that come in, but there's also a lot of young athletes that come in that are overexerting themselves trying to stay healthy. Or they're doing something that's a little too physically active, like mixed martial arts or something, you know, along those lines.
How about some of the weekend warriors, you know, guys that
yeah, weekend warriors, they're going to the gym and lifting weights incorrectly. I see a lot of osteoarthritis, degeneration of cartilage, for example. Also laxity in ligaments and loose joints. That's really common.
What about the expression, no pain, no gain? As I get older, I've noticed I have to really listen to my body. So if I overexert and there's pain there, don't push through it.
You have to
you better slow down,
listen to your body. If it's hurting, one thing that I tell my patients on a regular basis is usually when something is lasting for greater than 2 months, it usually doesn't go away on its own. It deserves someone taking a look at it and trying to come to a solution. It usually gets worse, not better.
What's the difference then between chronic and acute pain?
It really depends on what book you read in terms of the timeline. 2 to 3 months really defines the distinction between acute pain and chronic pain. Acute pain being pain that's recent, that's typically resolving on its own, whereas chronic pain typically is longer. It's often unknown in origin, or if it was something known in origin, it's kind of long past. And it's usually more of a degenerative process by that point in time, which requires different sets of treatments.
What's the difference between fibromyalgia versus, let's say, osteoarthritis?
Well, we don't really know a whole lot about fibromyalgia. Fibromyalgia very much is a neurological disorder whereby pain is sort of everywhere. And there's a lot to fibromyalgia. Fibromyalgia has a totally different set of treatment options compared to chronic pain in that, for example, osteoarthritis. Osteoarthritis is the direct result of damage to cartilage. And the damage is usually due to either acute trauma, so like a car accident, creating arthritis pretty much right away, or chronic repetitive strain injuries, like factory workers doing the same movement over and over, or a dental assistant leaning the same direction, using the same movements every day, wearing the cartilage away. And once cartilage wears away, it becomes arthritis. And that's what we term bone-on-bone, osteo or bone arthritis.
What causes a lot of the chronic pain, though?
The pain is from multiple things. It can be from instability, so a bone popping out of place, or we call it a subluxation. It can be due to ligament damage, so it can be due to the nerve fibers in a ligament. A ligament holds a bone together, a bone to another bone. If it gets damaged, then the nerve fibers become more irritated in that, and that can elicit a pain signal. And then the third thing is that you can also have degeneration of cartilage. Now, cartilage has no nerve tissue in it. So when your knee hits, the two bones hit together, there's plenty of cartilage there as padding. When that wears down or starts to become thin or even non-existent, it starts hitting bone on bone, and bone is full of nerve tissue. So it elicits massive pain signals. It's like if you ever bumped your shin on something, that's a bone hitting something, and it hurts.
My parents used to tell me all the time, stop cracking your knuckles, somebody's going to wear out all the cartilage. It's really bad for you. Oh. And I'm like, wait a minute, I've been doing it 40 some odd years later. I'm still cracking my knuckles.
Yeah, no, that's just releasing gas from a joint. That's different. Hypermobility can cause arthritis. So excess movement, improper biomechanics, or the way that joint is moving.
How about posture? How important is that as well?
Posture,
When we're sitting,
it's
when we're walking?
very debatable, actually. Posture, in terms of sitting straight in a perfect posture,
Right.
not necessarily. Standing takes a lot of pressure off of your back. You get about 50% extra load on your back when you're sitting, so it's not very good for us to sit. Our bodies aren't really meant to sit in this position for a long period of time. So there's a lot of theories on, well, is it okay to kind of slouch a little bit here and there? And I think it actually kind of is. It's good to kind of move your body. Your body's like movement.
How do we treat chronic pain? Maybe short and long-term solutions.
Yeah, so chronic pain it can be a really tricky thing to treat. There's a lot of conventional therapies that treat chronic pain, and there's a lot of alternative therapies to treat chronic pain. So conventionally, a lot of things that will help or try to treat chronic pain would be like pharmaceutical medications. A lot of these things, though, they don't get to the underlying cause of why the chronic pain is there.
How about if you want to go drug-free or au naturel?
Yeah, so in terms of that, there's a lot of options. And I think they try to be a little bit more permanent in their solution. My favorite one would be a regenerative injection. Although you can try physiotherapy, you can try IMS, you can try acupuncture.
Is that like a cortisone shot?
Cortisone is completely different.
Oh.
Cortisone is one of the strongest anti-inflammatories that we know.
A lot of athletes use them, right?
Cortisone is degenerative.
Oh.
So the substance itself will degenerate tissue if you use it too much. So we space the treatments out every 3 months with cortisone so that that doesn't happen as much. But cortisone is a temporary fix. You're not actually fixing why the cartilage is degenerating. You're not fixing the joint instability, and often what it would lead to is like a knee replacement or a hip replacement. In certain cases, it's indicated, absolutely. But in other cases, if we can try something like a regenerative injection, like platelet-rich plasma, for example, where we take your platelets, healing cells, and we re-inject them into an area to regenerate the cartilage, if that works for a patient, it's permanent. It's a permanent solution for them.
So we talked about healing, how we can really help with chronic pain. What about acute pain?
Acute pain typically is treated with rest, ice, elevation, compression. So reducing a lot of the inflammation and thereby a lot of the pain associated with that inflammation. It's treated with a lot of pharmaceutical medications or natural medications. You can also kind of use them interchangeably depending on the level of the chronic pain. And then after that, you make sure that that pain is actually gone. But it should go away within a few weeks depending on what it is, you know?
How about treating some of our ailments with acupuncture? I've used that in the past when I was involved in a terrible car accident. It really helped a lot during my recovery.
Yeah.
Now, acupuncture versus, let's say, IMS or intramuscular stimulation.
Yeah, so IMS is using quite a substantially larger needle. It's more so, I'd kind of term it more so Western acupuncture. It doesn't utilize a lot of the theories that traditional Chinese medicine uses with acupuncture. So IMS is sticking the needle into a really tight muscle or a pain area and then allowing it to release. Whereas acupuncture is, and it tends to be a little faster. Acupuncture can take a little longer to work. Sometimes it can take 6 sessions to work, or 8, 10 sessions to work. And it's using meridians or energy meridians along the body at specific points to alleviate pain. Both can be very effective though.
What kind of exercises or physio, doctor, would you recommend for somebody suffering through chronic pain? I'm thinking of maybe some of the aquasize, maybe in the water, easier on the joints?
Yeah, well, it depends. It depends on the person, you know. Sometimes exercise is fully indicated. Other times it's fully not indicated. Like, for example, if you have a partially ruptured Achilles tendon or something like that,
Rest.
you kind of need to rest it, and you could try something like a regenerative injection in that area to try and regenerate it. But if somebody has, like, say, for example, a herniated disc in their back and they can't weight bear, then exercise in water would be perfect. It would be ideal for them, right? Because all of the weight on their disc, herniated disc, is taken off, yet they're still able to retain the muscle mass that helps to stabilize the joint.
There's an opioid addiction crisis going on in our country, even here in Lethbridge right now.
Yeah.
And a lot of times people get addicted to painkillers. So we really have to be concerned about that. So what are your thoughts when it comes to painkillers treating a lot of the ailments?
Yeah, if it's chronic, you should try and go off of them. Our goal as doctors should be try to fix something, not just cover it up. And drugs are fantastic in a lot of ways, and especially to cover up pain and pain signals. But they're not fixing the reason why that pain signal is happening. My goal is to try and always, if we have the ability to try and fix why that pain signal is happening, get that person off of their drugs, that should be first and foremost, always.
How about seeing a naturopath, perhaps?
Yeah.
Some natural ideas, perhaps?
Yeah, so in terms of pain alleviation through natural means, yeah, there's a few.
Or inflammation sometimes?
Yeah,
Natural ingredients?
well, a lot of things can reduce inflammation. Even a really high dose omega-3 can reduce inflammation. Mariva curcumin or theracumin, it's a turmeric substance that's highly bioavailable. Even something like aspirin, salicylic acid, is derived from Salix alba, which is a plant. You can actually have the plant, which has other constituents in it. It won't cause an ulcer like aspirin can, and it has the same ingredient, just to a lesser extent. So it's a little bit more gentle in the way it works, but it also doesn't come with a lot of the side effects. So you can try things like that.
We have aloe vera plants in our home, because apparently they help heal a lot of ailments, especially if you burn yourself.
Burns,
with the aloe veras, right?
Very much so, yeah.
And that's still the case? It's still true?
Yeah, yeah, it is, absolutely. Yeah, it's mucilaginous, so meaning it's kind of gooey, right?
Yeah.
And it's soothing and cooling. So when you do get a burn, if you put it on, it's more of a, well, it helps to heal the tissue, but it also helps to take the pain away a little bit.
What's funny, we have the plants actually in the kitchen, so when I'm cooking and I always burn myself, it's readily available, right?
Just in case.
Just in case,
Just
yeah,
in
an
case.
emergency backup. Now, what about medical imaging like X-rays, CT scans, MRIs, and the like? Some people are quite concerned about that. Maybe some of the radiation, maybe some of the risks involved. Are they always necessary?
Sometimes they're absolutely necessary. Absolutely, yeah, for sure. Other times, you kind of can have an option. A lot of times you might not need an X-ray. For example, if you have a soft tissue injury and it doesn't seem like it's broken and you go to a doctor and you get an assessment, you might not need that X-ray radiation. Other imaging, like an MRI, doesn't use radiation at all. It's extremely safe and very effective. If we had more of them here, it would be a lot easier to get in for one. That's the biggest disadvantage to an MRI, is that the time frame usually takes around 6 months to get into one, unless you do it privately, of course. But you're always best to try and stay away from excess radiation. A CT scan will have more radiation, for example, than an X-ray, but sometimes it's absolutely indicated, even though it's not the best option.
How about concerns for pregnant women?
Yeah, you can't do imaging like an X-ray, or if you do, it's a last resort to use radiation. So an MRI a lot of times would be ideal to figure out soft tissue injuries specifically in a pregnant woman. Yeah.
The baby boomers are getting older. We have a lot of seniors, you know, in Canada, even here in Lethbridge, which is pretty incredible.
Yeah.
We love our seniors. How are you helping a lot of seniors, and what ailments are they coming to you with?
I'd say the number one is, well, chronic pain associated with lower back pain.
Okay.
Lower back pain and back pain in general is very common. Usually when someone has back pain, it is lower back. Just that's where a lot of the weight is transferred, and that's where a lot of the instability is. I tend to do a lot of regenerative injections to help to stabilize the lower back, or even pull in disc herniations. It also can help with that as well. But there's a lot of options, and there's a lot of different chronic pain ailments that I see.
But exercise also helps as well, right? Strengthening the back?
Exercise is really great. The most difficult thing I find with exercise is compliance. So if somebody comes in and I tell them to exercise, it's very difficult for them to go from 0 to 100% exercise. So you have to really
build up?
Gradually increase your exercise and activity, and you have to make it fun for a person. You can't just say, go to the gym. If the person hates going to the gym, they're never going to do it. Right. But if they love running and being outside, even just going for walks.
Like a walk around the block, perhaps?
That might be all it needs, you know, for that person to sort of get active again. Muscle is one of the main stabilizers to a joint. And it will increase blood flow, and blood flow increases healing to a joint or to an area of chronic pain. And so, yeah, exercise is huge, and so it's always indicated. I think that's why I work a lot with physiotherapists, because they can also help to direct that type of activity for a patient so that they're doing it properly in their rehabilitation.
Dr. Clayton Koganow, naturopathic doctor in Lethbridge with Well Vitality Health Clinic. Thanks for joining me in studio.
Thanks for having me.